I'm Caroline Fiennes. There are two Fieneses on the agenda today. And I don't work in conservation, but I work in charities and philanthropy in general, in many sectors and in many countries. And I want to talk about some of the lessons that we learn from evidence from those various different sectors. One of which is that we often find programs which work very well. We find some programs that work a bit, achieve a bit, and some which achieve nothing or which even can be harmful. And I want to talk a bit about lessons of how we can use evidence to avoid those latter ones and ensure that our programs are as effective as possible. Oh, there's someone else's slides. There we go. Sometimes we find that the evidence narrative is really dominated by impact evaluations and specifically by randomized control trials, of which I am a big fan and an advocate, but they're clearly not the only thing that we need. These are the stages of a project in outline. And at each stage here, we need evidence and information, but of various different types, because the research questions thrown up differ across these stages. So certainly not just impact evaluations at every stage, as we'll see. This first stage is before anything happens. And here, our goal is to avoid misdiagnosis. You don't have to take pictures of these slides. I'll put them all on socials later if you want. We need to avoid misdiagnosis and solving the wrong problem. My colleague, Professor Howard White, talks about how you don't need an RCT to tell you the effect of opening the clinic for an additional day a week if the boat only goes to the clinic one day a week. There's another example from northern Bangladesh where there's a lot of subsistence farming. And there, the harvest from one season sees people through the winter and most of the way until the following year's harvest is available, but not quite the whole way. So it runs out. And there's it's called the hungry season just before next year's harvest. And it's thought to be part of, we had it in this country, it's thought to be part of the root of why we fast during Lent, literally making a virtue out of necessity. But there is no virtue in hunger and starvation, particularly not for young children whose brains and bodies need to develop and for pregnant women. So research has developed an intervention which relies on the fact that during that hungry season in northern Bangladesh, there is work available in the cities which are not very far away. So it works quite well. And they looked then to see whether they could take that intervention to Malawi and Zambia. But there they discovered pretty rapidly that although there is work in cities during the hungry season, those cities are quite a long way away. And so that particular intervention is unlikely to work. So they were able to rule it out. And notice that that didn't require complicated research. It basically required a research assistant on a bus for a couple of days and a map, that's all. We also, within our needs assessment, need to understand what the people who are affected most prioritize. There are examples of organizations and governments, as you'll be aware, solving problems that people don't necessarily have. Another example of misdiagnosis is some work that we did with some donors who are based in continental Europe who are interested in education in Indonesia. They were interested in girls' education on the hypothesis that girls would either be participating less in schools and or that they would be learning less. But when we looked at the data, we found that actually neither of those things was correct. Girls were enrolled as much as boys, and they were learning at least as much. But we also found that for both boys and girls, their educational attainment was a long way below that of the OECD average. And so the problem with education in Indonesia wasn't girls' education specifically, it was just education in general. And so we were able to change that diagnosis. And again, that wasn't complicated research. It just basically, it took us within a morning. So then eventually we have a reliable diagnosis and we're shopping for a possible solution to it. We're shopping for good evidence about effectiveness. And here we need to use evidence, not just to produce it. And I say this because in grant making and philanthropy, we often seem to think that every grant needs to have some research or evaluation associated with it. And I see that creating a huge amount of waste because not every grant or every charity needs to be a test site, needs to be a research producer. funders are really influential here, I think, in driving this behavior. And this is why I took Bill's invitation to come and talk in Cambridge on a freezing cold, rainy day, because I think the single most important thing that funders can do with respect to evidence is to not require that every operating organization produces evidence and is a test site. Certainly not to produce impact evaluations. This is Cambridge, the city of Isaac Newton. We can use existing evidence to, as it were, stand on the shoulders of giants and to see further and to design better interventions. So we only need to produce evidence where there really is an important gap and where our evidence can be good quality. And this is why I'm such a fan of, oh, we're a bit behind. I'm such a fan of conservation evidence and its work on evidence synthesis, because it pulls together the existing evidence. And so it makes it easier for funders and practitioners and others to find and use the existing evidence, and also to see where there are gaps in it. We can use research as an input into our program design. And I say this because often funders ask grantees and operating organizations to produce evaluations, and often after the work, which kind of misses an important trick, as we'll see. So if you're a research officer in an operating organization, I think that this should be the bulk of your work, is finding and applying evidence from other contexts. So that involves understanding your context and also understanding what is likely to be acceptable in it. So you may know the work of Esther Duflo, who's worked on many issues in international development, including offering parents an incentive to get their children fully vaccinated. She started that work in India, and in some places there, it's been really effective. But in some other places, they can't run it because it's seen as bribing parents, which for various political reasons is not acceptable. So we need to look at acceptability. And this is kind of vital, and it can save us a lot of resource. But none of this is impact evaluation. So eventually, oops, we're ahead now. So eventually, we get to a point that we can run a pilot. And here, our questions are really practical. What does it take to run this process? If we're running a breakfast club, for example, how much food do we need? How many washers up do we need? How long does it all take? Also, targeting. Are we reaching the people that we need to reach, or in conservation terms, the types of species that we're trying to reach? I once saw an internal document of one of the world's largest foundations, which said that people rarely benefit from an intervention that they don't receive, or at least that they don't receive in full. So I wrote an article, for example, in the Financial Times about an education program that ran in India. It had run in 25,000 schools in Madhya Pradesh. And the aim was to improve educational attainment by improving teacher practices and reducing teacher absenteeism based on the UK's Ofsted inspection regime. But if an evaluation after 18 months found almost no effect, and that was because it turned out that the implementation chain had broken down. So most of the schools were not getting the intervention. And again, we don't need particularly complicated research to identify that. The process evaluation will help us with that. So all of this might sound really obvious, but in my experience, funders often require and sometimes sort of fixate on impact evaluations, whereas all these other types of research are possible and relevant in different contexts, and they can also save us an enormous amount of time and resource. They're relatively straightforward, and many of them involve using existing evidence, not necessarily producing new research. So at some stage then, we get to the point where we have an intervention, we think it's likely to work, we know how to deliver it, and then the question becomes, does it work? What effects does it have? Are the effects in line with what we expect based on the literature? So here, we might want to produce an impact evaluation. By the way, just this week, I came across a foundation which has run a program. It's been in sort of pilot stage. It has not yet got to the evaluation stage, despite the fact they have run this program for over 400 years. Professor Sir Richard Peto set up and ran the Oxford Clinical Trials Unit and ran some of the largest clinical trials in the world. And he gives this quote as a tenet of good medical research. And I love it because I see a lot of charity-generated studies which don't particularly ask important questions and don't answer them reliably. I think this comes partly from requiring everybody to produce impact evaluations. I've read dozens and dozens of charity-generated impact evaluations, and many don't ask an important question. Often they ask a question to which we already know the answer, or where the benefit of having the answer doesn't warrant the cost of getting it, or where the sample size is not big enough to ever be able to answer that question reliably. So we should only produce new research where there is an important question and where it's unanswered and where we can answer it reliably. My organization, Giving Evidence, has produced evidence and gap maps for various sectors in order to inform funders and practitioners and others and to identify where the gaps are. We did one about institutional responses to child abuse, where research is pretty scant, but fully 60 studies are in one of the boxes on the map, and pretty much all those studies say the same thing. So we know the answer to that now. And yet we found a charity registering a protocol to produce another study in that box. So this is not an unanswered question. It also means that not all grants need to have an evaluation attached to them. Not all grants or implementations throw up an important research question. This quote, I think, works the other way around too, that if you can't answer a question reliably, then perhaps don't try to research it at all. And here we can talk about sample size. One of the only instances I know where a bunch of programs run by different types of organizations have all been measured on the same metric, on the same research method, and independently by the same people is the UK's Ministry of Justice Data Lab. But when I analysed their evaluations, I found that 60% of them, of programs that they evaluated, or they tried to evaluate, run by charities, 60% of those programs were too small. They had too few participants, too small a sample size to ever be able to evaluate reliably. So we shouldn't be asking for or looking for evaluations of those individual programs, but rather combining those programs to look at collectively. In another example, one family services charity in the UK that I visited had about 15 different funding streams, each of which had about 10 grand attached to it, £10,000 attached to it for evaluation. And the research manager was going out of her mind because every year she had to produce 15 pieces of research, all of which she knew was subscale and going to be unreliable, because they were all attached to an individual grant. Whereas if she had been able to combine them, then she knew that she'd been able to produce, address some important question and to answer it reliably. So funders, please don't force this kind of behavior. Furthermore, producing reliable research, producing reliable research is hard, it's a specialism. And we need to ensure that it is done by people who really have the right methods and understand them. And often those are not in operating organizations. They don't need to be in operating organizations. So rather it should be produced by research experts. If we're going to run an impact evaluation, we need to use the right research method. And I'll put on socials later an example of a single program evaluated with different methods, some of which showed it worked pretty well, some of which showed a small effect. One, I think, showed a harm, the same program. And a rigorous research method, you can get a rubbish research method to say whatever you like, but a rigorous research method will give you the real answer. And it turns out that rigorous evaluations tend to produce answers which are small. A feature of our universe is that most programs have a small effect. So two implications of that. One is that we should be suspicious of spectacular results. And the other is to think about the incentives. If we ask operational organizations to produce the research on which we will assess whether to and decide whether to fund them, then we are simply providing an incentive for them to produce poor quality research. So eventually, we know how to run our program. We think it's effective. And here, the research questions become, again, very practical. How do we run this? What are the costs? And is it still acceptable? And are we reaching the kind of people that we are intending to reach? For funders, then, look at the process flow in your organization. This is a schema of that from my book. Think about how you choose what sectors and issues to focus on. Think about how you decide what organizations to invite to apply, how you decide what to fund and what to continue funding, what information you ask from grantees, what information you commission about grantees or about programs or about the sector, and what information you gather about your own practice in order to see how effective you are. My organization has worked with clients who are funders and foundations in many sectors to optimize these kinds of processes, to ensure that the right information is available at each stage, and that the teams, which can be staff or trustees and or other external committee members, are able to find and apply and understand and use that evidence in order to optimize their decisions, to make sure that the decision-making processes are expecting the relevant type of evidence at the right times and that they're being used well. Sometimes that work has involved reorganizing the teams a bit, so changing roles and decision rights, sometimes involving, we have trained people on understanding and finding and using evidence, and sometimes on identifying where they need to bring in additional people. So this then is a summary of what we've talked about. The main point, as I say, is that we need to use and to be open to using evidence from other organizations and other contexts. All of the references that I've talked about today, I'll put on social media probably tomorrow, to be honest. Thank you. I hope that's helpful.